These are the maxillary sinuses in the cheeks. These are the ethmoid sinuses here that are simply like cells between the eyes. We'll keep going back. The one thing that I do see is in the back on the sphenoid sinus.
Uh-huh.
So it's all the way at the back of your nose. You have a little bit of fluid in there. Other than that, the remainder of the sinuses look clear. I'm just gonna...
So no balloon. Well, that's good.
Let's see here. Right sphenoid sinus, ostium appears patent. So this is a picture. The other one was going like this, up and down.
Right.
This is taking a slice kind of like this.
Right.
And so this is the right, this is the left. This is the front of your nose. This is the sphenoid sinus all the way at the back of your nose.
Right.
That's the only one that I do see a little bit of fluid in. This gray stuff right here is fluid.
Yeah.
What the balloon does is it takes the tiny little opening and makes it bigger. This is the opening to the left sphenoid sinus. This is the opening to the right side.
Uh-huh.
I do see that on the right side it looks a little bit more narrow there, but it's open. I mean, right here I can see that it's open. I can see that things can drain. So I don't really think that you would benefit from anything. Essentially, in terms of balloon or surgery or anything like that, I see that the tissues here are a little bit thickened. There's nothing that I see that looks like an active infection or anything like that. These are the sinuses in your cheeks there.
Right.
Those don't have any fluid in them. They're open. Essentially what I had wondered is if you had kind of chronic fluid or infection in the sinuses that would drain out into your nose, causing the obstruction there.
Okay.
From a surgical standpoint, nothing.
No benefit.
Nothing that I see that you would benefit from.
Okay.
I mean, the one option, and I'm sure we talked about this in the past, but I can't remember. Wait, no, you were referred to me by Dr. Kesslin. So you've been tested by allergies. You've had so were you allergic to anything or?
Juniper and red cedar.
Okay, you had told me that you just had not enough to be able to really do anything about. So I've got to say that essentially your diagnosis is chronic rhinitis. And what that means is that you have a chronic runny nose or congestion that probably does have some allergy component. We just don't know exactly what it is. And the hard thing about that is that there's not any great treatment for it.
All right, I'll learn to live with it.
The medicines, as you've noticed, don't really work that well. The Flonase might help a little bit. It's not going to change things a lot. Surgery certainly does not help. Really, if things get a lot worse, start getting infections, let me know. I know that we're going to be following up for your ears anyways. But otherwise, I would just recommend observation for that.